Airway passage anatomy and its structure and its possible complications are very common during ETT tube passage. So upper airway anatomy is nose has nasopharynx, mouth has oropharynx, and both converge at the pharynx and form larynx and trachea. Trachea is in front and esophagus is behind there. So pharynx is U-shaped muscular structure extend from the base of the skull to the cricoid cartilage, divided into naso, oro, and laryngopharynx are known as hypopharynx. So, epiglottis, as the word epi is above, it is present above the glottis, separates oropharynx from laryngopharynx, and it covers glottis during swallowing to prevent aspiration of food into the trachea or food or any content. Larynx is a vice box. It's a nine cartilaginous bone, single thyroid, cricoid, and epiglottis, paired arytenoid, corniculate, and cuneiform cartilage are there. Vocal cords are formed by the conus elasticus, shielded by thyroid cartilage. Next is sensory innervation of upper airway is nose anteriorly innervated by anterior ethmoidal and ophthalmic nerve. Nose posteriorly is innervated by sphenopalatine or maxillary nerve. Palates are from palatine nerves from maxillary branch. Smell sensation is carried by the olfactory nerve, which is cranial nerve 1. And another one is tongue anterior two-third sensation is lingual nerve. Posterior two-third is facial nerve, and tongue posterior one third is glossopharyngeal, and then below epiglottis is vagus nerve, and to the larynx there is superior laryngeal branch of vagus nerve is there. So this is common anatomy of pharynx and its nerves up. Here in this image we can see there is epiglottis, and then there is hyoid bone, and then this one is the thyroid ligament, as you can see from the back posterior view. Superior conus of thyroid cartilage, cuneiform ligament, and then cuniculate cartilage, cricoid ligament with inferior conus thyroid. There is the cricoid, and then the trachea. So this is a normal anatomy from anterior and backward view. Here is the nasopharynx, and then they extends downward to the oropharynx, and then laryngopharynx, and then here is the epiglottis which separates, and then the content goes backward into the esophagus, and trachea is prevented. Vocal cord and voice box is present here, larynx is present here, and then goes down to the deep into the trachea. Now nasopharynx, oropharynx, and hypo or laryngopharynx is divided into these landmarks. So this is common anatomy of pharynx. As you can see, the innervation or the nerve supply is to the from the ophthalmic division, maxillary, mandibular, and also glossopharyngeal nerve, with some vagus nerve is supplying to this area are the uh, laryngeal positions.